And I call on Alison Johnstone to speak to and move the motion.
Thank you, Presiding Officer. I'm proud to lead a debate calling for greater recognition and support for all those who provide care, whether by working in our overstretched social care sector or providing unpaid care, and commit to the principle that high-quality social care should ultimately be free at the point of use. I thank all those who provided well-evidenced briefings and the young and adult carers and staff who shared their experiences with me when I visited the Edinburgh Young Carers Project this morning. The introduction of free personal care for the elderly has rightly been regarded as a success, providing greater security and dignity to elderly people across Scotland. Truly a case where Scotland has led by example. But in previous debates in this Parliament, we've heard that social care charges for those under the age of 65 put people under financial strain and limit independence. The Scottish Greens fundamentally believe that social care is essential to people's health, dignity and control. Recently, the Scottish Government has committed to making social care at home free for those in the last 6 months of a terminal progressive illness. There have also been proposals to make social care free for all those with conditions like dementia and other degenerative neurological conditions. I applaud all the campaigners, charities and constituents who've pressed hard for these changes, not least Amanda Coppell, campaigning for Frank's Law, and we cannot fail to pay tribute to Gordon Aikman, whose contribution can't be overestimated. These are positive steps, but in the long term we must be wary of moving towards a situation where our entitlement to free social care is based on a particular medical diagnosis. Many people believe this is discriminatory and can't be justified. If you need the care, then you need the care, and it shouldn't matter what condition you have or what age you are. And that's why the Scottish Greens believe we must commit to funding high-quality social care that's ultimately free at the point of use for all, regardless of age or medical condition. We know the Scottish Government has commissioned a feasibility study on extending free personal care to under 65s, initially for people with dementia, but extended to consider all conditions. And the Cabinet Secretary for Health and Sport previously told us she'd be happy to use that study as the focal point for cross-party discussions on extending free personal care to under 65s. And I would ask the Government to update us on the progress of that study and tell us when it will share its findings. It's time for those discussions on progressive changes to social care policy to begin, and the Government to make clear its position on the abolition of all social care charges. The integration of health and social care strengthens the case for moving towards a truly cohesive health and social care system, which is free at all points of use. But this debate is about unpaid carers too. According to Carers Scotland, unpaid carers save the Scottish economy £10.8 billion every year, close to the cost of providing NHS services in Scotland. 3 out of 5 of us will become carers at some stage in our lives. But the value of what carers do is not recognised. Nobody should face poverty because of the care they give, but research by Carers Scotland shows that a third of carers struggle to pay utility bills, 47% have been in debt, half struggle just to make ends meet. Carers UK Caring and Family Finances Inquiry found that on average carers lose £20,000 a year by choosing to care, and around 35% of carers who care for more than 25 hours a week are in poverty. And the cost of caring goes on because of lost earnings, lost opportunities to build up pension contributions. One of the young adult carers I met this morning had to turn down a university offer due to caring. Another had lost a job due to caring responsibilities. So the impact of caring on earnings is very clear. The Government made a manifesto commitment to increase carers' allowance to the same level as job seekers' allowance. And the Government has been reviewing the financial implications of topping up carers' allowance. We can't allow support for carers to be delayed or reduced, so I invite the Government to make their plans to deliver this manifesto promise clear. I also believe this top-up doesn't go far enough. Bringing carers' allowance into line with job seekers' allowance doesn't provide recognition of the vital work carers do, and that's why the Scottish Greens campaign to lift carers' allowance by 50% to £93.15 a week. And we want to secure a fair settlement with the UK Government and local authorities so that no increase in allowance will interfere with the payment of other benefits or increase any care charges people currently pay. We also believe there should be a premium for those who care for more than one person. The Government intends to increase carers' allowance for those caring for more than one disabled child, and today I urge them to take a broader view and consider everyone who cares for more than one person, no matter what age they are. And I'm glad the Government has agreed to consider introducing some form of young carers allowance, because we must provide better support for young carers and young adult carers. there are at least 29,000 young carers in Scotland with significant practical or emotional caring responsibilities. The demands of caring can have a detrimental impact on young people's mental health, on their educational attainment, on their overall well-being. And there's also strong evidence that the most financially vulnerable young people are disproportionately likely to have caring responsibilities. Recent research for the Children and Young People's Commissioner indicates that 27% of young carers come from the 15% most deprived areas of Scotland. The Carers Trust stress that young carers are always children, first and foremost. We should minimise their practical caring responsibilities wherever possible and provide additional support in a way which prioritises their education and personal development. The Carers Act is a good step forward. There was broad cross-party support for this important piece of legislation, putting carers' entitlement to support and respite on a statutory footing. And regardless of age, the importance of access to respite and the positive impact respite has cannot be overstated. And we have a duty to make sure these rights are delivered in practice. And there are many people too who don't realise that they are in fact carers and don't know they're eligible for support. I also want to call attention to the role employers can play in supporting carers. Juggling work and providing care is tough. All too often it gets too much. The organisation Employers for Carers points out that there are real costs for companies when they lose staff due to their caring responsibilities. And as our population ages, we need to develop more forward-thinking employment policies, making paid leave for carers widely available. So far, only 5 employers in Scotland have been awarded exemplary status by Carers Scotland. The power company Centrica is the only one in the private sector, so it's clear that employers of all kinds have a way to go. I'll now turn to the need to strengthen pay and conditions in the social care sector. The Government's commitment to pay social care staff the living wage was welcome, and I'm glad the Government has extended this commitment to personal assistants and social care workers in day centres. But I'm concerned, and I'd welcome the Cabinet Secretary and Minister's clarification on this, that there's no guarantee social care staff working with children are entitled to the living wage. Moreover, the living wage doesn't reflect the incredible value of this work, its emotional demands, the deep commitment carers bring to every care visit in every home by every bedside. Scottish Care's report Trees That Bend in the Wind provides an insight into the challenging role of social care staff who support people with progressive illnesses or people who need palliative care. Not only do they deliver increasingly complex care for the most vulnerable, but many have direct experiences of being by people's sides as they die. They are a vital support for bereaved families, and they have to manage feelings of loss themselves. Yet social care staff aren't afforded the recognition they deserve. And that's why the Scottish Greens want to pay all social care staff a living wage plus of £9.20 an hour. If we are serious about building a sustainable, compassionate social care system, pay for staff must reflect that. I believe it's the Government's long-term goal that sleepovers are paid at the living wage, and it would be helpful if we could hear about a timescale for achieving that. Now, I've heard from constituents working in social care that they're still not fairly paid for all the time spent travelling between shifts, or for all the handover shifts they do. Appropriate pay and better working conditions are badly needed to help us recruit social care staff and to retain people with that experience. Good pay progression and training opportunities for people working in more senior roles are essential. Roles in social care should be seen as positions to aspire to. Carers should have more opportunities to specialise in particular forms of care and to work collaboratively with other health and social care professionals. Carers and third sector organisations have told me that they're not adequately represented on integrated joint boards. There needs to be more joint planning across the whole sector to ensure greater stability. And many of us will be aware of the worrying example in Kirkcudbright, where a private sector provider pulled out of providing day care services in a care home, leaving service users with nowhere to turn. They were able to exit this contract with 90 days' notice. It's wholly inappropriate that crucial services can be pulled away like this. Nursing vacancies in our care homes are incredibly high. Up to 28% of posts are vacant. In the past, NHS workforce planning hasn't reflected the need to fill posts across the social care sector too. And I hope the new National Health and Social Care Workforce Plan will change this, because we really do need more stability, especially when Brexit could throw this already precarious sector into jeopardy. Immigrants make a huge contribution to our social care sector. We must protect their rights to live and to work here. And nor can we forget the need to improve the conditions and pay for all the other staff, the cleaners, the cooks who support the social care sector. It could not function without them. Presiding officer, without carers, the independence and quality of life of many is diminished. Human rights are not realised. Without carers, the burden on our National Health Service becomes even greater. Few jobs are more important. Let's make it clear that we understand that by making sure carers and all who work in the care sector have the recognition and the support they deserve. I move the motion in my name.